and we are on the fourth day now of the latest junior doctors' strike. It finishes at 7 o'clock tomorrow morning. Waiting list we saw last week going up to a whopping 7.6 million people. That's 1 in 8 people in this country waiting for healthcare, and we've seen 1 million appointments cancelled. Let's talk to Benedict Phillips. He's a transplant registrar in the NHS, and he is in support of those junior doctors on strike. Good morning to you, Benedict.
Good morning, Julia.
Thank you very much indeed for joining me. Why do you think that it's right for them to be going on strike, given the dire straits so many patients have been left in as a result of, well, long-term failures in the NHS, COVID lockdowns, and now the strikes?
Well, it's either that we disrupt the service to generate a message to explain the situation, or no one's here left. No one will be here to carry on the service.
What do you mean no one will be here? You're saying all the doctors are going to quit?
Either it's 4 days.
Oh, sorry, Benedict, I'm so sorry. Your line is cutting in and out sort of every couple of seconds. So would you mind restarting your answer again, just so we can make sure, hopefully, that we can hear it in full?
Sure. Yeah, I think that the situation is extremely difficult for doctors in this country, whether they are junior doctors or consultants. And actually, if the conditions continue to be extremely difficult and unpleasant, sadly, a lot of people will start to leave the profession or leave the UK to practice elsewhere.
But what you said a couple of moments ago, just when it cut out a little bit before, there'll be no one left. I mean, that's simply not true. A lot of people might say, I want a better life in Australia or New Zealand or Canada, but most doctors aren't going to leave. They're going to stay here with their families where they've made their lives. They're not going to leave the NHS. Is the pay demand that's being asked, the 35% pay demand from junior doctors and from senior consultants, look, no one thinks that's what's going to be offered. There's been about a 6% pay offer on the table for everybody else. Do you think that, I don't know, somewhere between there, 10%, realistically, best case scenario, would that be enough to mean that everybody who's thinking of emigrating decides to stay and everything's fine?
Yeah, no, I hope that I hope a deal is made, and as soon as possible. I don't have personally any particular figure in mind. I just think that there has been significant loss in wages as time has gone by. And a lot of us are struggling, really struggling. My wife is a gastroenterologist, and she has to walk dogs as a second job. I've had to find an alternative income. I've had to skip meals between surgeries, skip lunches, because it's just unaffordable. This month
do you mind me asking what you and your wife earn? If you don't want to answer, I completely understand. But, I mean, there are people who are on minimum wage who are able to afford lunch and can pay their bills. They're struggling right now. My goodness, people are struggling. But you're a registrar and your wife is also a senior NHS staffer, and you're saying you can't afford lunch?
Sometimes I choose to skip lunch because in central London and the cost of living. Honestly, Julia, I'm not lying to you, we've had to make major cutbacks to everything. It actually costs to be a doctor. This month I spent £600 on my mandatory GMC annual fee. I have to be a member of the Royal College of Surgeons.
Yep.
I have to pay indemnity. Genuinely, it's really tough, and it costs. I have to pass exams, and in order to pass exams, I have to pay for the fees. I didn't pass my exam this time. I had to redo it. That's another £500. Mm-hmm. Genuinely, it costs to do what we do. And
would you mind giving me a clue of the sort of income you're on, where you're saying you struggle to buy food?
Sure. No, look, I'll explain. So I'm 38 years old. Uh-huh. I've been a doctor for 15.
Of this, I do apologise, everyone. This line keeps freezing. No, I'm sorry. I'm so sorry, Benedict. It keeps freezing again. You're 38. You've been a doctor for 15 years, and carry on.
And the first time ever this year, I'm in my overdraft every single month. I'm in negative deficit. So it really is poor and depressing situation to be in.
OK. You're not going to... I mean, again, you're free. Feel free not to, but you're not going to tell me what you're earning, that you're struggling to pay for lunch.
But the net, I'm not going to come out with a figure because if I have my pay, I probably would. But
you're perfectly entitled not to answer.
Every month I have to. I'm going into an overdraft. I've got 2 children who have to have childcare in London. It costs me, £10 to get to work. The mortgage rates are going up. Genuinely, at the end of every month, it's a struggle. And I plan to stay in the UK as long as I can. But as soon as my elderly relatives are no longer with us, or my children are in university, I probably will go elsewhere.
OK, and that is a big concern. People who've gone through the training, and even though obviously you will have got into big debt going through your training, it will also have cost the taxpayer a fortune. We want talents like you and your wife to stay in the NHS. I'm all in favour of people, as a doctor's daughter, I bore everyone about, I'm all in favour of people who work very, very hard. You're getting top grades, you're working very hard, years of training, it is properly hard work, that you're paid well. I've got no issue with that, and we want that to be the case. What sort of salaries would be the sort of salaries that would mean that doctors stayed in the NHS?
I would say if the UK could match the situation in Australia, then that would be fantastic. Because all of us are going to...
We can't do the sunshine, sadly.
Can't do the sunshine, but the environment and the work environment is really fantastic out there. I hear every day people who've come back or going about, the pay being pretty good, about lots of other extra things that are helpful. Whilst working there, they get some tax help and things like that. If you could match the they get to pay their doctors pretty well, and the doctors are very happy. So I think anywhere close to that, genuinely, I don't.
Whatever that figure is, again, it depends on the cost of living. I mean, just finally, there'll be lots of people like me very supportive of people getting a decent pay rise and being treated well. And if it is the case that we can't keep doctors unless we pay more, then I'm sorry, guys, that's the deal. However, there's also an awful lot of people, including me, who say, you know what, I know you went, people working on the COVID wards worked really, really hard, and thank you very much to them during the pandemic. The NHS shut down to pretty much everyone else for 6 months. We're living through a crisis. We've got a lot of people who are unnecessarily dying because of those failures. A lot of other failures by government underfunding for years previously. I accept all of that. But we've also got a lot of people who will be damaged, hurt, possibly die as a result of NHS strikes, cancelled operations. Is this the time for doctors like you and others to be going out on strike when people are genuinely suffering and people are genuinely dying as a result of these long delays?
No, I think it's a horrible situation. I personally didn't expect or don't want any sort of special reward for being there during COVID. So nothing like that at all. But I think that the pay has gone down significantly. We would be nice to be able to get by. It's not the right time. The NHS is in a desperate situation, and it's horribly sad. I'm personally not striking because the service that I personally work in is not amenable to any change or shuffle. It's very sensitive.
Okay. All right, we'll leave it there. Benedict Phillips, I appreciate you persevering with that poor line. You've got a little one in the background as well. Appreciate that. Thank you so much for joining us. Interesting to hear that perspective.